Arthur, would you introduce Lee, please?
My pleasure.
Not that we don't know her, but
Well, yeah, I know. Lee is a good friend of our club. Besides being extremely personable, and we like her a lot in our club, and it's just a pleasure to introduce her. Lee is the executive director of the Agincourt Community Services Association, as most of you know, and she has two things in her mind when she runs this Agincourt Community Service. It's social justice and acts of kindness, which is what I fished out, Lee. And the Agincourt Community Service is a very busy place, and it's humming with activity. It has meals to given away, computer training, addiction support, assistance in affordable housing, financial empowerment, outreach for sex workers, homeless, drop-in center, and it has been a going concern and was established as early as 1970 by some church groups who got together. And now it's a thriving place and it's doing fantastic work, most impressive, and we'd love to hear from you what's happening now. Lee, you're on.
Thank you, Arthur, for that. I think that the fishing out the acts of kindness is probably the absolute best part of my job. And let me start off by saying it has been a heck of a last 14 months. When everybody shut their doors and headed for the hills, ACSA actually went back towards the doors and opened all of them last March 15th when the first provincial lockdown took place. We were in a staff meeting with my leadership team. Our phones all started pinging, and we had all started to receive the word that the schools were going to remain shut for an additional 2 weeks after the March break that was already about to happen. And we all just looked at each other and had no words because we weren't quite sure what that was going to mean for us. So we absorbed the shock, and we immediately said, there is no way we can shut down. There's no way. And I remember that first week, I think the second or third day, the Scarborough Mirror came over because they had heard that we were still continuing to offer programs. And, the line that became very prevalent is, why aren't you shutting down, Lee Soda? Why is ACSA not shutting down? And the only thing that I could think of saying at that moment was, shutting down is not in our vocabulary. We work with the most vulnerable people in the community. This is the place where people come to when there is nowhere to go. And with even more places shut down, this just was not an option for us. So we deemed several of the programs that ACSA runs as essential, and we kept our doors open, and we have continued to be open while everybody else has been shut down. You will hear that other agencies, social service agencies, are open, but folks have gone digital. And what I know for sure, and I always like to talk from a place of what I know for certain, is that people who are struggling, people who are hungry, people who don't have money, people who are struggling with homelessness, they don't get what they need in this format, in the format that we are using today, digitally. Most of those folks that I just mentioned to you don't even have this as an option. So shutting down was just not an option for us. I have taken the liberty, well, not I, but some wonderfully crafty, digitally savvy people have taken the liberty to put together a little 4-minute compiling of some photos of what has been going on over the last 14 months. I would like to share it with you, and then I will continue. But I think that in the next 4 minutes that you see this compilation of photos, it will give you a really good idea of exactly the breadth and the depth of what has been going on, from food bank to homeless programs to gardening programs to children's programs. We have honestly tried not to skip a beat to make sure that we have been here for our community, which is what we are here to do. And the pandemic was just not going to stop us. So hopefully I am technically savvy enough to be able to pull this off. Otherwise, I have people in the wings who are going to help me.
Okay, we got it.
Excellent. Okay, so this is a compilation, folks, of just the work that we've been doing. I've added some captions so that it gives you an idea of what it is that we are talking about. But again, I just wanted to show you just all of the things that have been going on. And we have deemed as essential programs our food bank. You can see it here. And the food bank has been serving at the peak of the pandemic between 1,300 and 1,500 households in Scarborough. That has come out to about 5,000 people a week that we have been helping put food on the table. Our children's programs, as you can see here, the staff have had to go virtual. We have not had an opportunity to have our children come indoors, but the staff have not skipped a beat. Our after school programs, when the schools are open, we make sure that we get in there to offer some after school programs to our kids. Schools, of course, are closed now, but you can see them here, still attending. I have to tell you, Rotarians, that this agency has the absolute most dedicated staff I have ever had the privilege of working with. Our community gardens continue to thrive and give pleasure to a lot of our residents and our seniors, growing food, being outside. Here's the food bank again. I have never seen so many green bags in all of my life, constantly being prepared to give out to people in the community unable to put food on the table. We have dubbed ACSA as our tagline during this pandemic, and it has truly been an expression of caring for community that we have continued to pursue. We have taken it a step further with another program called COVID 360. 360 meaning, completely around, which means that we have been very, very well aware that in North Scarborough and different Scarborough communities, there has been an absolute incredible uptake, or not uptake, there's been a lot of incidences of COVID positive cases. And that is because North Scarborough has a large number of essential workers living in Scarborough. So there are grocery store workers, there are Uber drivers, there is a large number of PSW workers, essentially frontline workers that also live in Scarborough. And so it is those frontline workers, those essential workers who are out there working during the pandemic, taking the bus during the pandemic, that are showing up with higher COVID positive rates. And so we were getting a lot of phone calls from folks that were really struggling and unable to get out to go and purchase those essential items that they needed. A lot of households that were mom and dad and a couple of small children And when Dad came home with having tested positive, that little family was now stuck. And, you know, Mom would now also would have to quarantine. Therefore, this now little family would have no access to having to go out and get the essentials that they needed to be able to be in a 2-week lockdown. So we created this this COVID 360 program, and it allowed us to be able to receive calls from folks that were in this kind of situation, and we would be able to prepare these hampers, not only of food, but other essential items. And we also incorporated a delivery service to our families in North Scarborough. I cannot tell you folks what an absolute, honestly, just blessing it has been for these families to be able to have access to this kind of service. There was also an incredible uptick in the number of seniors that we had reach out to us as well, asking for this service. Vulnerable seniors that during COVID have had, who have just really been scared to leave their home. And so finding out that they had access to food and hampers of essential needs being able to be delivered to them has also been something that we have been able to incorporate in the essential services that we've provided for the community. Most recently, I'm sure that you have all heard of the vaccine hesitancy. The rollout of our vaccines has been less than graceful, and you've seen the pop-up clinics that have also that the media has shown us, with the lineups of folks waiting, you know, around the different places that they have set up these pop-ups. ACSA has just recently taken the opportunity to work with the City of Toronto and take advantage of leading a really important piece of work called the Community Vaccine Engagement Teams. And so we are working with residents, we are working with other stakeholders in North Scarborough to be able to really mobilize and work with resident leaders, ambassadors is what we are calling them, that when the pop-up clinics are announced, when they are sort of determined as to where they're going to be in all of the hotspot postal codes in North Scarborough, we get boots on the ground and we really mobilize people, and we knock on doors and we flyer up the community, and we use the people that we know that live in these communities to spread the word so that we can get as many people vaccinated as possible. I think that there's been a little bit of a misconception that there's a lot of hesitancy in our communities during the vaccine rollout. What we are actually seeing is that people want to get vaccinated. It has become an equity issue, unfortunately. And what we are also really fighting for and advocating for is that Scarborough, or the parts of our great city that are demonstrating a higher need, should be getting more vaccines. And that's what it means to have an equitable approach to making sure that everybody gets what they need. So there is a lot of advocacy work. We are working with our city councillors. We are working with our MPPs. We are working with our MPs. There isn't anybody we're not working with in order to make sure that the good folks of Scarborough are all taken care of, not only through service delivery, which is what ACSA does, but also to be able to mobilize on this grand scale opportunity for Scarborough residents to get vaccinated. Part of the work that we've also been doing, not only getting people to vaccine clinics, there also has been a big piece of the work is setting up the appointments to get people vaccinated. there is, to go back to the equity issue, there is a lot of people who live in Scarborough who don't speak the language, that don't have access to computers, that are working folks and don't have the time to be able to, wait on the phone or keep checking back on the website for an available appointment to get a vaccine. So the ACSA staff have also taken that on as well. It has become, our biggest focus right now is getting people vaccinated, while we are of course doing all of the other things to engage with people and to serve people with food and homeless programs and housing and all of those other important things. So I'll stop there and offer opportunity if anybody has any questions for me.
Buddy, you got any questions for Lee?
Hi, Lee. May I know, is your location at 1950 Kennedy Road, Scarborough?
1911 Kennedy Road.
On 1911?
Yes,
I think one of our locations. I see. I saw one at 1950, but I'm not sure is that one of your location,
No, not 1950. It's 1911 Kennedy Road. We have 6 locations throughout Scarborough. And 1950 is not one of them.
Oh, okay. Thank you.
Anybody else? Danny?
Lee? Yeah, Lee?
Yes, Danny.
Yes. Yeah, the hub is part of your organization, right?
Yes.
Yeah, I was working down in the vaccine clinic down there. And the lineup, it was not a huge lineup. Actually, it cleared fairly quickly in the morning. But what they're doing with the pop-up clinics, when you see those huge lines, the huge lines are not people waiting all day to get a vaccine. They're waiting for a ticket, right? Now, what I was going to say to you is, for the people who are maybe not here absolutely legally, and they don't want to go to these places, is there any way you could work with a hospital, or we could work with a hospital to get a batch of tickets for you specifically in the mornings, rather than have them line up with everybody else?
Yes, that's a great question, Danny, or a great statement. And I've just actually, before I came onto this call today, I sent an email to Scarborough Health Network asking for exactly that. Could we get a batch of tickets to disseminate to the Scarborough residents of whatever postal code is being focused on? So I think that that's a great idea, and we can certainly take on that additional piece of work. I will also share that we have teamed up with the Center for Immigrant and Refugee Healthcare, which is located right across the street from our Shepherd site here at 4155 Shepherd. It's 4158 Shepherd. And Dr. Paul Colford and I have teamed up, and we have done now about a half a dozen clinics together where he gets the vaccines from Scarborough Health Network, and then of course we have the clients, and we are able to work together to get the most vulnerable populations also vaccinated in a very orderly fashion, fashion way, by appointments, so that people don't have to deal with these, long lineups. So that's also another avenue for us working with Dr. Colford to get people vaccinated. And the priorities are being given to those that are experiencing homelessness. We really want our homeless folk in Scarborough to get vaccinated. And, with working with agencies like ACSA, what we have also found is that people who do have some hesitancy, people who are worried, concerned for whatever their reasons are for getting vaccinated, when they are approached by people who they trust, which is our workers who work with them, and able to escort them as well. So folks that are struggling with homelessness that come to our drop-in know our staff, they are trusted, and that our staff are present here during the vaccine clinic, or that we go across the street to Dr. Culford's center. It puts people at ease. And so that's another mechanism that we know works. Use us who have the trusted relationships in the community to also lower that hesitancy or that fear of people, and therefore more people will get vaccinated.
There is always also an opportunity in the evening when the vaccine clinic closes. We got a call last night at 9 o'clock because my wife also volunteers in the clinics, and she was waiting for a vaccine. They called last night and said, "Come down within 30 minutes. We have vaccine left over." And when we were down there, they said to us, "Do you know anyone in the postal district that is looking for a vaccine? Can you call them?" So there's an opportunity at the end of the day so that we don't waste those vaccines, right?
Absolutely. Absolutely. Yes.
So you got a question?
Yes, Lee, the membership application you sent out for membership in ACSA, is this the first time you've done this?
No, we typically send out the application for membership along with all of our AGM forms. I will tell you, Basil, we are not the most tech savvy folks, or maybe I should speak for myself. And so it should be going out with all of the AGM invites. But I've got somebody much younger and savvier than me this year helping me. So I know that membership form went out this week or this time.
Eddie, you got a question?
Yes, two in fact. Hi Lee, how are you?
I am well, thank you. How are you?
Good, thank you. So Lee, I have two questions. One is a follow-up, kind of an add-on to what Danny Cassidy was saying. So do you guys work with vaccine hunters, or do you have any other app where people can go on a wait list and they can be summoned at short notice, and they don't mind being summoned at short notice? Because this has been extremely helpful in the States, and Vaccine Hunters is doing a great job here in Canada as well. So do you work with them? That's question number one. And number two as well, I'll put it out there, is shoppers initially said, if you register for a shot, we give you 100 extra points and things like that. So now that they're lowering the minimum age for kids as well to be vaccinated, 12 and above, can we come up with some kind of an incentive program for the vaccine hesitant to come forward, in addition to their comfort of working with someone they know, like your organization and yourself?
Mm-hmm.
Is there any legal ramifications? So those are my questions. Thanks.
Okay. So we are not working with vaccine hunters specifically, but in terms of that list of folks, that if there are, like Danny said, vaccines that are still available at the end of the day, all of the staff here have access and phone numbers and our texts, WhatsApp groups, that if that were to happen and I were to get a call at 9 o'clock to say, listen, there's 20 vaccines that are left over at Lamoureux, can you reach out? And we can reach out to large numbers of people in a very short period of time to get the word out that this opportunity is existing. Can you go now? And if people can, of course they will. So we do have access to folks in that way. And I'm sorry, the second part I wrote down.
It's about incentives for vaccinating, especially vaccine hesitant families. Can we do something as clubs in the Scarborough region? And also, are there any legal ramifications to your knowledge, incentivizing people to come and get their vaccines done if they hesitate?
So certainly I'll be honest with you. I know that there is a whole lot of talk about this vaccine hesitancy, and I see it with my own staff. I'm not going to pretend that it doesn't exist, right? But I think that it has been heightened to a level that isn't accurate. I think that it's more on the other side. I think that people do want to get vaccinated, and we are working on sort of taking on multiple methods of getting people out there. And part of the work of the vaccine engagement teams that are now being organized by the City of Toronto is that dissemination of information, of reliable information. And I've had my own experience here with my staff as well, who will, they will say things like, well, no, I'm sure you've heard about, the horrific X, Y, and Z of taking vaccines. And we live in a world where there is so much misinformation, fake news, even if you want to call it, that we are also having to combat that. And I think that if we all do our part in disseminating valuable, reliable information, and we keep it on repeat, and we keep telling people about the benefits of vaccines, I think that population that has a hesitancy is far lower than we are being led to believe. I know that there are people who are hesitant, but I don't believe that it is in the proportion that we are being led to believe. Right? Let's make these vaccines available, and let's make them 24/7, and let's make more of them available. People will get vaccinated.
Anybody else? Okay, thank you, Lee. Michael, can I ask you, you're scheduled to thank Lee, please?
It's always my pleasure to hear from Lee Soda. She's been a regular with our club, and she always has some very informative information and fills us in on a lot of things that the media does not necessarily convey to the public. And that's always a pleasure. And it's a pleasure for our club to help support ACSA too. So Lee, thank you very much for your presentation today. Everyone enjoyed it. Thank you again.
Always my pleasure. Thank you for inviting me, and thank you for always giving me an opportunity to share not only the work of ACSA in the present, in the past, and sort of where we're thinking in the future. It's been an unbelievable 14 months to be on this journey, and thank you for the opportunity to share what it is that we've been doing and continue to do. Thank you.
Okay, Lee, thank you. As I mentioned to you, you're welcome, for want of a better expression, to hang around, but I'm sure you're very busy. So if you want to leave, by all means do so.
I have some city councillors that I need to go whisper in their ear, so I'm going to do that.
You need to shape.
You may have to shout too.
Yes. Thank you.
Thank you
for having me.
Bye-bye.
Okay, bye-bye.